Hello and welcome everyone to our Breast Cancer Care WA webinar, Managing Fear of Cancer Recurrence. My name is Leah Marinovich and I am one of the early breast care nurses at Breast Cancer Care WA, and I'm delighted to be hosting today's webinar. I'd like to begin by acknowledging the traditional owners of the land on which this webinar is being recorded on today, the Whadjuk people of the Noongar Nation, and extend my respects to elders past and present. We pay homage to them today in their rich storytelling culture and sharing of knowledge for thousands of years. Now, I'd like to introduce our speaker today. We are very lucky to have Associate Professor Ben Smith joining us. Now, I'm not sure how Ben fits this all onto a name badge, but Ben is a Senior Implementation Scientist and Cancer Institute New South Wales Career Development Fellow at the Daffodil Centre, the Cancer Council, and the University of Sydney. Ben has over 10 years of research experience focused on ensuring equitable access to evidence-based cancer care for all people living with and beyond cancer. He is currently leading the development and implementation of a culturally sensitive clinical pathway, which is like a step-by-step plan for health professionals to tailor support to people who are experiencing fear of cancer recurrence. Now, we did have a little technical glitch on the day, so unfortunately, we do miss the start of Ben's presentation where he introduces himself and does an acknowledgement of country. So it will cut in straight away into his content, but we have captured the important parts of what he has said, and I hope you get lots out of it. So thank you for joining and enjoy, and we'll pass over to Ben. Thanks.
So just to note here, as I said at the beginning, fear of recurrence is a very common experience for people affected by cancer. So we know that almost all people will experience some degree of fear of recurrence, but for about 60%, so more than half of people, they will experience moderate to severe fear of recurrence. And for this group in green, about 40% of people, I guess, well, I just want to note that fear of recurrence exists on this continuum. So at these milder levels, these worries or concerns might actually be kind of helpful in motivating healthy behavior. For instance, it might reduce risk of recurrence or even help you, I guess, monitor for symptoms appropriately and make sure you're attending all your follow-up appointments and that kind of thing. But, it's when it's getting into these moderate to severe levels that we start to, I guess, become concerned about the kind of impact that it's having on your life. And we're going to talk about some of the ways to manage that. But as I said before, very common experience. You're not alone if you're having these worries. And I don't know how many people there are on the call who may be caregivers or loved ones of people affected by cancer, but I think it's important to note that this is something that affects caregivers as well. Some studies have actually shown that it can be even fear of recurrence can be even greater in the caregiving population. And that's often, I think, because people or caregivers are holding on to these concerns and they don't want to burden the person affected by cancer with them. But what research has shown is that when a person affected by cancer and their caregiver actually are able to share these concerns, it does seem to lower the levels of fear of recurrence for both people. So I'd encourage you to try and engage in conversations with your loved ones about this, because it's probably something that they're experiencing too. So I promise this is about as technical as we'll get today in terms of, I guess, just trying to help you understand why Some people experience more severe fear of recurrence, and for other people, it's kind of the occasional fleeting thought that comes up around their follow-up appointments. This is a model that has kind of underpinned a lot of the work that we've done trying to address fear of recurrence. And what it what it proposes is that if you look at this left-hand side of this figure here, um, cancer is obviously a very significant life event for people, and it causes a stress response, so kind of cognitive and emotional ways of trying to cope with that impact. And in the process of kind of, I guess, normal adaptation, those coping strategies will kick in and help people return to what's commonly referred to as a new normal. But where things can get derailed a little bit and cause this heightened fear of recurrence is or a key factor in that is what are called metacognitions, or unhelpful beliefs about worry. So these can be beliefs like worrying is kind of dangerous for me, or if I worry too much, I might bring on a recurrence of the cancer, for instance, or also positive. So people might think that or if I worry, then I will be more prepared and more likely to catch a recurrence early. So those are some of the examples of these beliefs about worry that some people can have. And what this causes is a very focused attention towards the threat posed by a recurrence, which in turn heightens this stress response as well as fear of cancer recurrence. And you can get kind of trapped in this spiral as the threat of recurrence increases. You feel like it's more important for you to worry, or could be more dangerous if you worry, and this really ramps up the levels of fear of recurrence. And this can be further exacerbated by risk factors such as past history of cancer in the family, for instance, and also uncertainty created by a lack of information. So I'm going to talk about some strategies to kind of address some of these drivers of higher levels of fear of recurrence. Before I get into that, I just wanted to, I guess, note who is likely to be at risk, or things to consider if you're kind of thinking, oh, what, am I likely to be one of those people who might experience more severe levels of concern or worry? So fear of recurrence is more common in people who are living with or beyond cancer, who are younger, female, and might also have more generalized anxiety. And it's often triggered in people who have physical symptoms that might be related to the diagnosis and treatment of cancer. What makes this really hard for doctors, nurses, other clinicians to identify people with fear of recurrence in clinical practice is that it's not very closely related to clinical factors like cancer stage or severity, or the type of treatment you've had. So these are normally kind of flags for clinicians regarding who might be more at risk of certain side effects or concerns. But unfortunately, in this instance, we know that fear of recurrence can really affect anybody regardless of their cancer stage or type or the treatment they've received. This does just bring me to another point, which I'll touch on again later, but it does mean that fear of recurrence is often missed in clinical practice, so or not asked about. The work that I'm doing on the clinical pathway that Leah mentioned, that's really aiming to ensure that fear of recurrence is routinely asked about, it's discussed with the clinician, and tailored support is offered to address that's appropriate to the level of concern that people have. But please don't be afraid until that becomes routine practice, which is probably not going to be tomorrow or next year or even the year after. If you're experiencing these concerns, I'd encourage you to bring them up with your healthcare team because, they're a normal, understandable concern, and they should be able to provide you with access to further support if it's needed. Some people, and this is true of kind of friends and family often, but um, if you've been affected by cancer, you might know that this is not the case, is that a lot of people expect that these fears will just kind of go away over time. And apologies, this is a slightly busy graph, but this is some data from a study of almost 1,000 people diagnosed with breast cancer. And it tracked them for 5 years. So along the bottom here, we've got the years of follow-up, and along this y-axis here, you've got the level of fear of recurrence. And the colored lines are showing the different trajectories of fear of recurrence. So there's one group here, about 10% of people who have low levels of fear of recurrence that kind of just stay low over time. There's another group, about a third of people whose fear of recurrence does go down slightly over the course of 5 years. Another group that starts a bit higher and also reduces. But then you can see there's actually these two groups that make up almost 30% of the population. One who starts a little bit lower and then increases over time, and then a group of almost 1 in 5 people whose fear of recurrence starts high and stays high over 5 years. So, I guess you could think, oh, that's a bit depressing, but I guess the point I'm trying to make here is don't assume that if you have these concerns that they're just going to go away. This shows that if they're left unaddressed, then they often do persist. So it's important to, I guess, try some strategies to address them if you do experience these concerns. So when does fear of recurrence become a problem? I mentioned that, there's some group, maybe 40% of people who experience minimal levels of fear that might be very occasional and not very impactful. As I said, that's completely normal. But if your fears or worries are starting to affect your mood or sleep, kind of causing you to withdraw socially and become very kind of ruminative and focused on on these concerns, and ultimately stopping you from enjoying your life, then that's when it's starting to become more of an issue. But just a reminder that I guess a lot of the interventions or strategies that I'm going to talk about now, that the goal, we know that these thoughts or worries are almost impossible to get rid of, and that's not really the goal of these strategies. It's actually to try and kind of turn the volume down or change the way that we engage with these thoughts or worries. So just keep that in mind, when I'm talking through these next bits, and also, when you're trying to deal with these thoughts, that it's very normal to have them. It's kind of how you ultimately engage with them that might change how much of an impact they have. So I'm going to talk about some strategies that come from an intervention called Conquer Fear. I mean, these strategies were delivered in the context of an individual face-to-face intervention with a psychologist, delivered over 5 sessions. So it's a bit hard to say which ones worked or didn't work, and that's likely to be different for different people. But I'm going to just, I guess, cover some of the main components of this intervention that you might find helpful. And the focus of this intervention is on trying to change those beliefs about worry, called metacognitions, and ultimately help people assign less importance or attention to these worries, and to live a life that is consistent with their values and goals. And I like this quote from John Kabat-Zinn, who's one of the kind of founders of modern mindfulness, who says that you can't stop the waves from coming, but you can learn how to surf. So we're really trying to, I guess, change the way that that the analogy here is you can't stop these thoughts from happening, but you can learn how to kind of manage them so they're having less of an impact on your life. So the Conquer Fear intervention, which was developed here in Australia and trialled by the Psycho-Oncology Cooperative Research Group, or POCOG, it comprised 5 kind of main components to it. This values clarification. So, I mean, it's very normal for people affected by cancer to perhaps reconsider what's important to them in life. But it's not always explicit to people, what their new values might be. So it went through a process of helping people clarify those. It also involved attention training, which I'll talk about a bit more, but essentially try an exercise to help train your attention so that when these thoughts about potential recurrence come up, you're able to direct or have greater control over your attention and direct less of it towards those thoughts and more towards valued activities. So detached mindfulness is just a form of mindfulness that is basically focused on trying to teach people that thoughts are just thoughts, so you don't have to engage with them. Metacognitive therapy is about challenging, I guess, the positive or negative beliefs about worry. And also, there was also an element of we know that people with high levels of fear of recurrence can sometimes engage in a high degree of self-examination behaviors, or going to see their healthcare team for kind of medical reassurance. So there was also an element of kind of coming up with agreeing on what was an appropriate amount of follow-up to engage in. I guess just to show you, I'm not going to focus on this too much, but just to show you that as a whole, when delivered by psychologists, this intervention, which, as represented by the yellow line, was shown to be effective at reducing fear of recurrence immediately post-treatment, but also, those gains seem to be maintained over time. And it was trialed in comparison or in relation to a relaxation training intervention, which also helped reduce fear of recurrence, but just not as much. And we found that for people with moderate levels of fear of recurrence, so kind of to begin with, they actually benefited just as much from relaxation. So I've included some relaxation training tips in the resources that I've provided at the end. So these are some screenshots from, we actually, so we recognized at the end of that initial trial that it's great to have this 5-session psychologist-delivered intervention for people with severe fear of recurrence, but that wouldn't necessarily be something that everybody was able or wanting to access, and that some people might benefit from more accessible and self-directed form of intervention. So we developed I Conquer Fear, which is a self-directed online program based on the Conquer Fear content. And we did show that was had some promising effects in women with breast cancer, actually, but then subsequently we adapted it for women affected by ovarian cancer and found much more mixed results. So regrettably, it's not available at the moment, and we're at a bit of a crossroads as to what to do with I Conquer Fear. But I guess I'm just showing you these screenshots as a way of I guess, highlighting some of the contents. So this, or some of the strategies that were included in the intervention. And this one is values clarification. So this is taken from acceptance and commitment therapy, and it involves essentially, like, it's a card sort task. So it involves sorting out these different cards with different values on them into from most to least important. And then subsequent to that, once you've established what your most important values are, then developing some goals and objectives to um, help guide your everyday activities, because values are kind of like stars, I guess, that we kind of guide our lives, or we can kind of work towards, but we never quite get there. So the goals and objectives are important in helping you take steps towards living a life that's consistent with your values. And so step people through a number of kind of steps in determining those goals. Now, this icon fear is not available, but I do provide a link to a similar online task in the resources. It's something that I'd encourage everybody to engage in. Something I think is just a generally beneficial exercise, and I think for a lot of people affected by fear of recurrence, I guess it really can highlight the impact that those worries are having if they're taking you away from the activities that are consistent with these values and objectives. So the second component you'll remember is called attention training. So this is a pretty odd exercise, I have to say. When you first do it, you may wonder, what's this got to do with my worry about the cancer coming back? Because what it entails is listening to an array of different sounds and focusing in on particular sounds and then switching between different sounds. So it sounds a bit odd, I know, but what this is essentially doing is like going to the gym for your attention muscle, and it's by building up this ability to focus in on particular things and then switch your attention. You're able to direct less of your attention to these thoughts and worries when they come up, and more of your attention to, I guess, engaging with the outside world. And I guess the other beneficial thing about this is that we know that physical symptoms and side effects can often trigger fear of recurrence. And it's been shown that this exercise can help people go from being very internally focused to much more externally focused. So they're engaging with the world, and so those internal symptoms are having less of an impact. So again, I've linked to freely available resources in the resources slides, which will be made available at the conclusion of this. The other thing was detached mindfulness. Now, this is just a particular type of mindfulness, and I guess what differentiates it from other forms of mindfulness that you might be more familiar with is it's not necessarily focused on the breath or anything like that. It's really but it uses different metaphors, I guess, to help people appreciate that thoughts are simply just thoughts. You might think of them like clouds floating by in the sky. It doesn't matter what you do, they will keep floating on by. You don't have to concern yourselves with them, or you can't control them. So it's probably not a good idea to try to. Or you might alternatively think of them as any thoughts about recurrence as like a train passing by at a station that you don't need to get on, because if it's not going to a destination that you really want to get to. So it's really helping people kind of diffuse or get less caught up with these thoughts about recurrence. Not trying to stop them, as I mentioned before, but trying to get less caught up with them. And again, there's some mindfulness resources on the research resource page. So the other thing that you can do in terms of challenging these common beliefs about worry to build up a kind of bit of a for and against tally for suggesting that might help you decide whether these beliefs about your worries are really true. So as I said before, some people are quite believe that if they worry a lot, then it might actually make their cancer come back. And there's not any good evidence to suggest that's true. I can say that from the literature. I think there was maybe 1 or 2 studies in mice originally that showed that this might be could be true, but subsequently in humans, there hasn't been any evidence to show that. And one example of evidence against this that you might take from everyday experience is, well, do I know anyone who's really stressed or worried about, always worrying about stuff that hasn't got cancer, for instance, like your boss at work? There's someone that's really worried, but they haven't developed cancer. So is it possible that maybe the link between stress and cancer is not as strong as you think it could be? So there's again, this is a tool that you can use that I've linked to. So you might think about tallying, creating this for and against kind of ledger. Another thing that you can do, I think, that a lot of people anecdotally reported in the trial as being very helpful, that can, I guess, help you perhaps challenge beliefs about the uncontrollability of worry in particular, is this exercise called worry postponement. So essentially, that is putting aside some time each day where you decide that is going to be my worry period. Only caveat is try not to do it too close to bedtime. Obviously, could cause you to lose sleep if you do that. But let's say you say after dinner, and if you have any worries during the day, what you can do is write them down. Say, I'm not going to worry about that now. I'll wait till my worry period, so immediately after dinner. And a lot of people say that, when they get to that period, often they're no longer worried about those things. So they, I guess it makes you appreciate that these are just often, fleeting thoughts that you don't need to engage with. Nothing bad happened because they didn't worry during that period. And also that it's something that you just don't need to engage in. So that's a tool you can try. And the other thing that was included in the intervention, and I noticed that Breast Cancer Care WA has some great programs to encourage this, is people who are encouraged to engage in activities which, like healthy eating and exercise, that not only reduce the risk of a cancer recurrence, but also can help people really regain a sense of control over their lives, which I think is often taken away when you're initially diagnosed and going through treatment, having all these things kind of done to you, but without much agency in the whole thing. So engaging in these kind of healthy living type programs post-cancer can really help regain that and reduce these fears. And actually, there's been there's some good evidence to show that mind-body activities like yoga or Tai Chi, for instance, have been found to be very useful in reducing fear of recurrence. As I mentioned before, so one thing about these fears or worries is that it can cause people to kind of withdraw, and I think that can create a very heavy burden for people to shoulder on their own. So I'd really encourage everyone here to find someone you trust. Might be a family member, might be a friend, it could be a psychologist. So it's going to be much harder if you really try and do this on your own, or there's no need for you to do that. I know that some people do struggle to, I guess, or worry about kind of burdening family members with these concerns. So if you don't feel comfortable talking to a family member, then perhaps trying a support group, or there's kind of one-on-one support available through places like the Cancer Council. Maybe Breast Cancer Care WA has similar programs. They can really help reduce the sense of isolation, and also just normalize these concerns, like talking to someone else who's been through that experience. If you don't have access to that, and you're still reluctant to share with others, then there's also good evidence to show that writing or journaling regarding these concerns can help you kind of process those feelings and get less caught up with them. And I guess that I haven't really touched on it a lot so far, but I guess one thing that people often do, and people might be like, why would I want to write about it? That's just it sounds terrible. It'll just make the feelings worse. And that is, I guess, an intuitive kind of feeling, but what's actually been shown is that what is less helpful is actually trying to push these thoughts away, avoiding them. And one analogy that I've heard a therapist use is like taking if you imagine holding a book in front of you, and really, trying to push it away as hard as you can, like directly in front of your face, you're trying to push this book away. Ultimately, you can't see anything because of the book's right in front of your face. Like, you end up focusing on that anyway. And also, the strain of pushing things away can actually kind of lead you to focus on that even more. Another classic example is if I tell you not to think about a purple giraffe, like, whatever you do, just don't think about a purple giraffe for the next 5 seconds. Inevitably everyone ends up thinking about purple giraffes. So just try to be, I guess I'd encourage everybody to be wary about trying to avoid these feelings entirely, because that can ultimately increase the sense of threat and make it harder to deal with in the long run. And as I mentioned, I think it's important to raise these concerns with your healthcare team if you do have them. And also, as I noted earlier, so uncertainty or lack of information can contribute to these fears or worries. And often it's uncertainty around what your actual risk of recurrence might be, but also kind of what you should do in response to symptoms, which are a very common trigger for these fears. So I'd encourage you to talk to your healthcare team about what they recommend in terms of your follow-up and self-examination schedules, and also what to do if you do notice a symptom, how long you should wait, whether it matters what type of symptoms or symptom it is, and what you should do if you need some help with a new symptom, or one that's particularly severe, for instance. Like just having a plan on how to respond to symptoms can be very useful for people. And I guess just one thing to note is that, maybe you don't want a lot of information about this stuff. That's fair enough, but good just to let your healthcare team know, what level of information you feel comfortable with. So just a few, I guess, final behavioral strategies that you can try to help manage these concerns. So I'd suggest, you set some limits on self-examination, but also examining the internet where there's a lot of um, you know, dodgy information. But so try and visit trusted sources if possible. If you're going to go on the internet, or limit the use or the amount of time you spend on it, set a limit on that. And also another common trigger for fear of recurrence is when people have follow-up scans or appointments where they might be getting the results of scans. And I was just in another webinar last week with a person with lived experience of cancer who said that they always have a very specific plan for what to do in these situations. So that includes making sure their phones fully charged, having an idea of what they'll do while they're waiting. They like to listen to a podcast or some music. Noting who's going to come with you. As I said, it's great if you can, if they're available and it's something you want, to have a family member or caregiver present. Also these concern, like any questions you might want to ask to clarify any areas of uncertainty, and then sometimes planning a pleasurable activity afterwards can be helpful. And definitely don't, I guess, plan to do anything particularly important, because we know that these fears in the short term can cause a lot of disruption. And as mentioned before, if you're able to clarify, what the important things are to you, it might be, spending time in the outdoors, then, engaging in, making a plan to go for a walk once or twice a week in your local park can be a way to, I guess, follow that to live meaningfully and reduce these concerns. So, there's some different strategies you could try. And like I said, there'll be some resources to help you put those into action. But I guess it's important to note when it might be a good time to seek some extra professional help. And that is if you note that your fears or worries are getting very preoccupying, so you're having trouble kind of not engaging with them, and they're disrupting your everyday activities. If you got this if you're hyper focused on what's happening in your body and constantly checking yourself for signs of recurrence. If you're doing things like avoiding going to see a doctor, um, uh, for routine follow-ups, it's probably a good sign that maybe some extra help might be needed. And if you're generally finding that these fears or worries are stopping you from engaging in your everyday activities, and also making it difficult to plan for the future. Some people with more severe fear of recurrence say they find it hard to imagine their future self. So if you're putting off that trip that you were planning for many years, then maybe it's a good time to think about getting some additional help. So how do you get that help? I mean, clearly, I guess everyone here is probably linked in with Breast Cancer Care with WA. I mean, that's a great source of support, and there are obviously different ways that you can get in touch with Breast Cancer Care WA and different services that they offer. So hopefully you can find some that amenable to you. And as I said, a lot of the things in those healthy living programs, for instance, or living well after cancer programs, are very consistent with the evidence around what's helpful in terms of reducing fear of recurrence. But so that's, I guess, a way of getting support in the community. But you can also talk to your healthcare team, so your oncologist, nurse, or general practitioner about referral options within the centre where you had your treatment. So places like Royal Perth, Fiona Stanley, and Sir Charles Gardner all have like in-hospital clinical psychology support that you should be able to get a referral to. And if you're treated privately, then they should also have links to clinical psychology that might be administered in the community. So yeah, a couple of different options, I guess. The good thing, and I strongly encourage you to use Breast Cancer Care WA's services, but I guess it's also good just to talk to your healthcare team about this, and so they know that this is a concern and that they can help you get further support if needed. So I'd just like to finish by saying that firstly, just a reminder that fear of cancer recurrence is very common. It's entirely understandable, but the good news is that we also have a lot of things that can help with this concern. You're definitely not alone if you're having these experiences. They affect both people living with and beyond cancer and their loved ones. There are options for managing your worries, but if you try some of those and they're not helping, then please seek further help. There's plenty of support available. And I guess just in terms of very general resources that you can think about accessing, Cancer Council has this Living Well After Cancer booklet, which is available in multiple different languages and has a section on fear of recurrence. There's also a great fact sheet from the Australian Cancer Survivorship Centre on fear of recurrence. And there's the Centre for Clinical Interventions, which is based in Western Australia, or CCI, they have a lot of great mental health resources, which are not necessarily cancer specific, but include a lot of the kind of strategies that I've been talking about today. So mindfulness, relaxation training, worry postponement, those are all things that they have some great fact sheets on. I'd encourage you to check them out. They've also provided some links to values clarification tasks that you can do online, and also attention training videos on YouTube. Finally, just like to thank all the people that I've worked with on fear of cancer recurrence research and trying to get it into practice over the last few years, and particularly the Cancer Institute for funding my fellowship it's been focused on this area. And then happy to take questions, and thank you for listening. I hope there's been something useful in there for you, and yeah, looking forward to answering any questions that you might have.
Thank you, Ben. Thank you so much. That was excellent, really informative, and I know I gained a lot from that. I'm sure lots of people at home did as well. There are a couple questions. So the first one is about the slide you brought up with the busy graph, and and that 20% with the initial high, the group that had the unchanged levels of fear, are they less likely to benefit from something like the I Conquer Fear intervention?
No, so those graphs are essentially charting, I guess, trajectories of fear of recurrence in the absence of any kind of intervention. It might have been that there were some people in that cohort who did seek, I guess, some form of intervention, but most of the participants in that study had not had any support for fear of recurrence. So the main takeaway from that graph is that fear of recurrence doesn't necessarily just go away by itself, but it is definitely amenable to change if you engage in some of the strategies mentioned, or a psychologist delivered intervention for fear of recurrence.
Thank you. And another question about the established risk, well, the risk between high levels of stress and cancer. And this participant is saying that every clinician that they've had contact with has mentioned the risk of high stress levels. Uh, Mentioned getting on top of cancer stress as a takeaway. Um, yeah,
Yeah.
essentially
I
saying,
mean, look, I think there's, as I said at the beginning, I'm not a clinician, so I'd encourage you to talk to your medical specialist about this. And certainly there are lots of benefits to getting on top of like chronic stress in general. Like that's definitely, but one of, what I'm not sure exactly what you mean by getting on top of it, but one of the ways that is kind of been found to be more broadly beneficial is through things like mindfulness and just living in the present moment, and not kind of engaging in stressful or what worrisome thoughts. So, but my understanding of the research is that as far as recurrence goes, so maybe I'm less familiar with the research around initial cancer diagnoses. But as far as recurrence goes, there is minimal evidence in humans to suggest that there is a link between worry or stress and cancer recurrence.
great, thanks, Ben. You've got lots of thank yous and how helpful this was from healthcare professionals, social workers, nurses. Here's another question. A participant had a basal cell carcinoma removed at the age of 26, and one melanoma removed, and then had breast cancer. Are people who have had skin cancer and breast cancer at more risk of a recurrence? I don't know if you can answer that, but
Yeah, again, I'm not sure. As I said, I'm not a medical professional, so I think, Amanda, that's a really good question to ask your oncologist or your surgeon. Um, they're really good things to talk about with your medical team, and just clarify what your risk of recurrence is, and talking to them about, I guess, what you can do to minimize that risk, if it's both on a kind of from a health behavior point of view, as well as, I guess, then also thinking about psychological strategies you can use to, I guess, help you cope with those worries about recurrence.
great, thank you. And this one, maybe not necessarily a question, but I think it highlights quite well what we've been talking about today. But this participant is taking a chemotherapy anti-cancer drug to prevent her breast cancer coming back. She had 8 months of chemo, surgery, radiation, and now this. It's only after 12 months that the anger and fear has started to come through. And she's seen other people in her life who have had cancer return. And she's seeing her oncologist this Friday, but she feels like she's going to shout at him because she's so angry, and it's been quite distressing. She's got a husband coming with her to the appointment, but this webinar has made her realize that she needs some more outside help, potentially like a support group, and wanted to say thank you. So
Yeah, like it sounds like Lauren is doing. It's a um, yeah, as we saw, like there's all sort people have these concerns. They come up at all sorts of different times for people. For some people, it's just after they finish treatment, and that kind of immediate contact with their healthcare team is taken away, and they're like, "Whoa, what now?" For some people, it kind of creeps in a bit later on. It's all, I guess, you know, it's all very understandable, Lauren. I'm glad you're getting help. Yeah, both from family, but also, externally. I think that's great.
Mm. And I'll just add to that, is that we have at Breast Cancer Care, we have support groups. We run 16 support groups a month, a mix of online and face to face, and they're sort of geographically all scattered around WA. So get in touch if you do want to join a support group, and they will allocate you to an appropriate support group. They're separated between, they'll put you with other people with early breast cancer, and young women have a specific support group as well. Plus, there is obviously the counselling service, which can see clients or their family members, and then the Living Well program, which is really getting up and going now and has lots of really great activities to get involved in with that. So just wanted to add that in there. We've got a little bit more time. Another question, Ben, is this participant returned to work full-time 1 year ago, and finding it very hard to deal with that question, where do you see yourself in 5 years? Because who knows what can happen with recurrence between now and then.
Mm.
She's nervous to take on another role, as that could increase her stress levels, as she's been told by 2 oncologists that she needs to avoid this. She wouldn't say her fear of cancer recurrence is high or extreme, but enough that she struggles to plan her future work life.
Yeah, I mean, look, that's tough if it's, I guess, impacting on your future planning. That is normally a sign that maybe some additional support might be useful. But for that person, if they, I guess, this is where kind of, just rechecking your values after cancer can be helpful, and maybe, the taking on a more stressful job is not, like, even if it might be more like have a higher status or pay attached to it, maybe that's not important to you now. So if that's the case and you're choosing, not to take on that job because you'd prefer to spend your time and energy on other things, then that's fine. But or that's great. But I think I guess if you're struggling to think or plan ahead for the future more broadly, then maybe some additional support would be useful.
Great. Thanks, Ben. I think that's about it. There's a lot of thank yous and how helpful it was. So we might wrap it up there, if that's okay, Ben, unless there's anything else you want to add.
No, just to say thanks again. I mean, it's really great to see all the feedback there, and I hope people have found it useful, and maybe just to think about like the one thing that they can take away from today that they can kind of put into practice in the next week, whether it's been trying one of those strategies or maybe making a call to get some extra support. If I've been able to help in that way, it'll be very gratifying.
Great. Thank you, Ben. We really appreciate your time. Thanks very
Yeah.
much.
Well,
Thank
thanks
you,
to Breast
everyone.
Cancer Care for the invitation. It's been great.
No worries.
Thank you.
See you later. Thanks, everyone. Bye.